Well, the state of Indiana plans to release facility-level COVID-19 data for long-term care centers. This comes after months of pushing from families and lawmakers as well as advocates. Kelly Rinke has more on that.
More than 45% of COVID-19 deaths statewide are linked to Indiana's long-term care facilities. And soon, anyone will be able to find out how many cases and deaths have happened at each location.
So to have those tools available to anybody, not just a family member of a resident already there, but to anybody out there looking, I think that's an absolutely wonderful thing, and it's about time.
Sarah Trapman's father lives at Bethany Point in Anderson. More than 30 COVID-19 related deaths have happened here. She says at first it was difficult to get information about cases inside. Now the company that operates that facility posts updates on a dashboard online.
I still think it probably comes down to every day people are still looking for facilities to put their loved ones in. I mean, just because coronavirus is out there doesn't mean that people their family members aren't failing in their health and aren't needing extra care that they can't provide for them at home.
For months, state officials refused to do something similar. They said it was a personal matter between the facilities, residents, and families. Indiana does require facilities to provide daily updates to residents and their representatives. Then a few weeks ago, the state admitted it did not have a cumulative list showing cases for each facility. That's what made this announcement yesterday so surprising.
As we have all learned, responding to this pandemic requires us to continually evaluate our approaches and, when appropriate, to change them.
As for the why, Dr. Dan Rusniak said AARP was a group that recently supported this move. 44 days ago, AARP Indiana sent a letter to the governor urging the state to publish the data. Dr. Rusniak also mentioned the support of the Indiana Healthcare Association, one of the state's largest associations that represents these facilities.
We look forward again to making sure that what ends up getting reported publicly is as accurate as possible.
Troutman is relieved all families can get this information a little easier soon. Yet she's still questioning why the state is deciding to publish the data now after months of saying no.
I wonder, but enough pressure, I think, from families and the media. I think eventually they probably figured none of us were going to go away.
In Indianapolis, I'm Kelly Rinke.
And the state says the health department's resources until now have been focused on early identification and mitigation of outbreaks. They say they now have the resources available to create a dashboard. Preliminary data is expected by mid-July.